So the mission of Kearny County Hospital is to provide quality, compassionate healthcare services for this community and really to enrich the lives of the people we serve. And this organization really focuses on mission alignment. The model has gained traction because it's drawn medical staff that are so difficult to come by.
One thing that I think is a little bit different about what drew me here was some time off to be able to do some short-term medical mission work.
Paid time off, the allowance there just helps recruit people knowing that they can have time away.
Our mission is to serve our family, friends, and neighbors here in this county first, but we don't ignore our obligation or our passion for serving our family, friends, and neighbors on the other side of the world.
In 2007, I went as a medical student to West Africa, to Ghana, and I remember there was a man who was riding a motorcycle on a country road, no helmet, and he had a wreck, and he got a big laceration on the side of his face. As a medical student, I got to suture that up and repair that. And then amazingly, 3 years later, I went back as a resident to that same hospital. And I saw this guy at the gate, and I saw his face, and I recognized him immediately, and I said, that's the guy 3 years ago that I sutured up.
I did go to Zimbabwe 4 years ago with John Berkey, and I've been back every year since. I was so surprised, not by the differences between rural Kansas and rural Zimbabwe, but I was surprised by the similarities.
So, here we think of kids having accidents on four-wheelers. Well, over there it was ox carts and mango trees. Kids would follow the trees, or they would be riding in these wagons pulled by oxen and fall out, and so we'd have broken bones.
We saw some of the same struggles in rural Zimbabwe that we see here in rural Kansas. You know, people struggle with access to care. Well, it just looks different.
It's no secret that rural Kansas often has a difficult time retaining physicians, recruiting and retaining physicians. Having something greater than money as an incentive is what it will really take to recruit physicians to rural areas.
Wichita in particular is known nationally for training some of the best rural family doctors in America. It's a gem. It really is one of the state's best healthcare resources. They
encourage students to do rural rotations and to get rural clinical experience. So I think those are some good things that KU is really doing. When I was looking for a place to go and to work and practice, to me it made more sense that if there's a place where there's a huge need and you can do something to meet that need, that's really gratifying and it feels good, and hopefully you're helping others feel good by the service you're providing.
We're focusing more on the need that we have here than the traditional benefits. When it comes to conveniences, you know, physicians can find those things in many areas, especially urban areas, but if they are really seeking to work in an area that is gratifying because they get to meet a need, then we are very competitive.